Welcome to our Advanced English Learning Podcast. Today, David and I will guide you through a realistic doctor-patient consultation. Imagine you're Lisa, a patient who's just arrived at Dr. Raymond's office after feeling unwell. David, can you set the scene for us? Absolutely, Mia. Lisa checks in at reception, then sits anxiously in the waiting room. She's been experiencing persistent chest discomfort, fatigue, and occasional dizziness. We'll show how to express these symptoms naturally in English as the consultation unfolds. Great! And as we transition into the consultation itself, listen closely for the advanced vocabulary and formal expressions that are key in medical settings. Exactly, Mia. Let's walk through their first exchange and highlight essential greetings and introductions, which set a respectful, professional tone. So, Dr. Raymond greets Lisa politely. Good morning, Lisa. What brings you in today? This formal question is standard in English-speaking clinics. Why is it important to phrase it this way, David? That's a great question, Mia. The phrase, "What brings you in today?" is open-ended, inviting the patient to share details in their own words. It's much more welcoming than a simple, "What's wrong?" and helps build trust. Exactly. In response, Lisa might say, "I've been feeling some chest discomfort and I'm unusually tired." Notice the use of the present perfect tense "I've been feeling" to describe symptoms over time. Right, and that tense suggests the issue is ongoing, which is crucial information for any doctor. Shall we break down how to describe symptoms in detail next? Perfect transition, David. Let's dive into symptom description strategy. Lisa says, "I've had a persistent headache and sharp pain in my abdomen." Mia, why is it important to use adjectives like persistent or sharp when talking to a doctor? Those adjectives give the doctor a clearer picture of the problem. Persistent means it's ongoing, and sharp describes the pain's intensity. Imagine a doctor deciding between a muscle strain and something more serious. Specific words help guide their diagnosis. Exactly. Lisa could also mention, "The pain comes and goes," or "It worsens when I stand up." This provides context about patterns, which is often a diagnostic clue. And if you can't find the exact word, it's helpful to compare, "It feels like a tight band around my chest," for example. Analogies make it easier for English learners to communicate discomfort. After initial symptoms, Dr. Raymond asks about Lisa's medical history and lifestyle. Have you experienced anything like this before? Or, do you have any chronic conditions? Why are these questions essential, David? They help the doctor identify possible underlying conditions. For instance, if Lisa says she has high blood pressure or a family history of heart disease, that changes the urgency and next steps. Lifestyle habits like smoking or diet can also be contributing factors. That's right, and notice the use of polite questions. Could you tell me about your exercise routine? Or, have you recently changed your diet? These forms keep the conversation respectful and thorough. Exactly, Mia. Gathering complete background information is just as important as current symptoms, especially when diagnosing complex issues. Let's focus on how Lisa describes her pain. It's a dull ache that sometimes turns sharp. Mia, what's the benefit of distinguishing between dull and sharp pain? Doctors use pain quality to narrow down causes. For example, dull pain might suggest muscle strain, while sharp pain could point to nerve issues. Using descriptive language helps the doctor interpret symptoms more accurately. Lisa might also say, "I experience shortness of breath when climbing stairs." This is more informative than just saying, "I feel tired." Absolutely. Specific examples like "after walking for 5 minutes" give doctors measurable information, which is crucial for diagnosis and treatment. Dr. Raymond follows up with clarifying questions. How long have you been experiencing these symptoms? Or, have you noticed any swelling or fever? Why are follow-up questions structured this way, David? These questions use the present perfect "have you been experiencing" to establish duration. Doctors need to know if symptoms are acute or chronic. Clarifying questions ensure nothing is missed, and they often paraphrase, "So, just to be clear, the pain is worse at night?" That's a great communication strategy. Repeating or rephrasing helps avoid misunderstandings, especially when patients are nervous or using a second language. And for learners, it's helpful to listen for these cues. They signal that the doctor wants to make sure they've understood the details correctly. Now, let's explore how Dr. Raymond explains the need for tests. Given your symptoms, I'd like to run some diagnostic tests such as a blood test and ECG. Mia, how does he reassure Lisa in this situation? He might say, these tests are standard and will help rule out any serious conditions. Using polite, formal expressions like rule out and standard procedure helps calm patient anxiety and clarifies the next steps. Exactly. He could add, it's important that you don't worry at this stage. Many people experience similar symptoms that turn out to be minor. This addresses emotional needs as well as medical ones. And if Lisa's nervous, doctor. Raymond might further explain, let me clarify what the ECG measures. It checks your heart's electrical activity. Analogies, like, it's like a snapshot of your heart's rhythm, make technical terms accessible. Suppose Dr. Raymond finds no signs of heart disease. He might say, your tests came back normal, which is reassuring. It might be stress-related fatigue. David, why is the use of modals like might and should important here? Modals express possibility and recommendation without sounding absolute. Saying it might be stress-related shows uncertainty, which is honest in medicine. He can then advise, you should consider reducing your workload and ensuring proper rest. Exactly. This approach balances reassurance with actionable advice, empowering the patient to take steps toward recovery. And if further steps are needed, Dr. Raymond could say, we should schedule a follow-up in 2 weeks to monitor your progress. This makes the plan clear and collaborative. Let's talk about treatment explanations. If Dr. Raymond prescribes medication, he might say, take 1 tablet twice daily after meals. Mia, how does he ensure Lisa understands these instructions? He often paraphrases, that means you'll take 1 tablet in the morning and 1 at night, always after eating. He might also check understanding. Do you have any questions about how to take the medication? And if there are side effects, he could warn, you might feel a little dizzy at first, but it should pass. If anything unusual happens, contact me immediately. This prepares the patient and builds trust. Clear, simple language and checking comprehension are vital when discussing medication, especially if English isn't the patient's first language. As the consultation ends, Dr. Raymond might say, if you have any concerns before our next appointment, please call the clinic. David, why are these closing remarks so important? They provide reassurance and maintain an open channel of communication. Patients often worry after leaving, so phrases like, don't hesitate to reach out, or we're here if you need us, encourage follow-up if new symptoms appear. And from a language perspective, these polite, formal closings teach learners how to end conversations with professionalism and warmth. Absolutely! It's these small, gestures-courteous language and clear instructions that make healthcare interactions smoother for everyone. Now it's your turn. Pause and practice. Describe 3 symptoms you've experienced or imagine being Lisa and answer Dr. Raymond's questions. David, what's the benefit of active role play for language learners? Role-playing boosts confidence and fluency. By putting yourself in realistic situations, you internalize advanced vocabulary and grammar, making it much easier to recall under pressure, say, during a real medical visit abroad. Exactly. And remember, focus on clear descriptions, use present perfect and modals, and don't be afraid to ask questions or clarify instructions. We hope this episode helps you navigate healthcare settings with confidence. For more practice, listen again and repeat key phrases aloud. Until next time, stay healthy and keep learning.